is hip extension. Which motion's that?
Extension?
Yeah, going back, correct? Okay. So with that said, that's what we're trying to prevent. So you're trying to prevent that motion. So though you're not going to completely resist, or you're not going to completely do away with it. You're just going to give them some resistance to prevent them, you know, to that far extreme. But also in the same breath, I have them step on here, and so when you do it, when it talks, read the aspect, read all that stuff to me.
Yeah, procedures?
Yeah.
Begin just above the patella. Spiral the ace wrap up to the groin. Remove approximately half of its elasticity. Overlap the ace wrap by about half its width. Secure the loose end of the ace wrap with 3 short strips of white tape.
Wait, is this the right one? Hip flexor?
Oh, sorry. I jumped over to the other side of the paper.
I'm so confused.
Taping procedures. Have the athlete stand and position them with the leg on the affected side slightly in front of the uninjured leg. The athlete should step on the object so that the hip is flexed 60 to 90 degrees and the foot should be straight forward. Anchor the loose end of the ace by wrapping the ace medial to lateral around the leg. The ace should be positioned so that it is going from top of the thigh between the athlete's leg, pulling the leg into internal rotation. After going around the leg, angle the wrap up toward the opposite hip across the front of the body and around the waist to return to the injured hip from the back, creating an X over the aces. From the hip, angle the wrap down across the front of the hip between the athlete's legs around the thigh, returning to the body. Repeat steps 3 through 5.
Okay, alright, you're done.
All right.
So I'm going to pretend like it's her right leg that's hurt, okay? So I'm going to have her step up here, okay? So what I'm pretending is everybody can feel their hip bones, like,
Yeah.
okay. So right here is those hip bones right there on the front, you know, that crest comes down here and sits right here. So we're going to pretend like right there is where our X is going to be at. So what we're talking about medial to lateral, and so I slightly, and this is a 4-inch double, okay? Or you can use a 6-inch, depends on what you got. So I'm just gonna overlap this, angle that bottom one, so here. But then when I come right here, I'm gonna feel for the top of her iliac crest, and I'm gonna try and split that right here, okay? So I'm gonna come right here, come back through here. Now I'm gonna say this to guys, okay? Anybody that's ever done any rappelling, that sling that you tie at your rider, right? So in this process, you might try to adjust yourself to make it comfortable, okay? And all you're doing is you're just trying to create that X over here. That's a good guy, yeah. And I just ask them to kind of adjust themselves to the side so that you can make it happen. Okay, now I wouldn't end it right up here. What I'd probably end up doing is I'd just come back to the leg right here, just so I don't have to put tape up around the waist. That makes sense? And then I usually go right there. So then when she does step down, go ahead and step down. Does that kind of feel like it gives you? Now lift your leg up. Does that kind of give you a little bit of a spring to it? So in essence, I want everybody to try and walk with it because it kind of has a little bit of a spring, but it does. It resists your leg from going backwards. Okay? Does that make sense?
Yes.
Okay. All right. That's the first one. Okay. Okay. Now the hip adductor one. Okay. Nuts and bolts to what that one is. So what I'm going to have the athlete do is I'm going to have them stand facing me, slide forward, and this foot's going to be internally rotated, okay? So I'm still same concept. I'm going to go around the leg, come medial to lateral, and an angle for the splitting the iliac crest with the bandage, come back here. But this time, instead of having an X on the front, everybody can feel their hip bone on the side, right? Right here. Your X is going to be crossed here. So when you do that, you have to do that, and you're going to almost, in the aspect, you're going to kind of cup the butt a little bit, or cover more of the butt when you come across, okay? Make sense? So, internally rotated. Okay, right here, I'm going to come down here, so this is where that X is going to be on the side. So this is where I'm going to kind of cover part of the butt, and I'm going to be a little bit more flat right here. Okay. Again, you have to make this comfortable to the athlete, okay? You got to be careful of the groin area. So what, now just stand straight for me. Okay? So my whole goal, can you rotate? And everybody see how if you were to cut this right down the side right here, how that's reasonably in the center of her leg, or where that hip bone, right there. Okay, does that make sense? So the only way you're gonna make that happen, if you don't kind of cover part of the bottom half of that butt, it's always gonna be kind of slid forward, okay? So just cover part of the butt, come back around, and it should sit reasonably on the side of that leg. And the whole purpose is you're internally rotating, so now we're trying to resist that motion of that foot being externally rotated and pulled out, okay? Make sense? So everybody first do the hip flexor, please. And then